Hello everyone, my name is Yasmin Ahmed from Raffah Hospital, Sohar. Thank you for joining this live session, and in case if you are having any inquiries, you can message it in the comment box or message us on 960-96060. Hope during this COVID-19 situation, you are all staying home and safe. Today, our topic is going to be about pregnancy and nutrition with our specialist gynecology Dr. Zaheeda Abdula. Hi doctor, how are you?
Hi Yasmin, how are you?
Ramadan.
Ramadan Kareem to you.
Hope you are doing great.
Yes, alhamdulillah.
Doctor, we would like to introduce yourself to our audience.
So to my lovely audience there, this is Dr. Zaheeda with you, specialist gynecologist working at Sohar. I think you all must be knowing me, most of them. And yes, Ramadan Kareem to all of you.
Thank you, doctor. First, I would like to start to ask you one of the frequent asked questions about during this COVID-19 pandemic situation, if it affects the pregnant and her baby.
Very good question, Yasmin. I think I have seen most of my patients, when initially the pandemic came up and the horrifying situation around, I've seen most of the patients coming in telling me, Doctor, I am pregnant. Will this virus affect me or my baby? Let me tell you, this is just like the other flu. This is just like the other flu. Until and unless you don't have any health conditions like cardiac or conditions or lung conditions, this is not going to affect you much, nor your baby. In case of baby also, there is no high risk of miscarrying or causing any abnormalities in the baby. And would like to also stress that according to the studies that has been found, the women in the last 3 months of pregnancy, and if they happen to get infected by this COVID-19, the risk is a little bit more because it's your baby, you have a pregnant uterus, so that compresses your lung capacity gets reduced. So once you get a viral infection, severity is high, and you tend to have preterm delivery or admission to ICU. So I would advise all the pregnant ladies out there, if you're in the last 3 months of your pregnancy, request your employer to give you permission to stay at home and work.
Precaution must be taken.
Yes, that's the Bible everywhere. You need to take the infectious control precautions like wearing a mask, wearing the gloves, social distancing, hand washing.
Thank you, doctor, for your answer. Now I would like to ask you first for the pregnant women or for the women.
What you need to say the pre-pregnancy.
Yes,
right?
The pre-pregnancy. What the precaution they must be taking for?
That's very good. And when I get a patient of planning to have or get pregnant, I feel this woman is the most organized. You should always plan your pregnancy. Why? Because you need to be in optimized condition of your health before you start your pregnancy. Until your pregnancy is not well optimized condition, that can affect your health as well as the health. Now you must be wondering, what is this optimized condition? Go to a gynecologist or whoever you're following, get yourselves checked. Get your hemoglobin level checked. Your hemoglobin level, the level should be 11 grams for all the pregnant women. It should be optimized. Now if it is less than 11, how can you improve yourself? You have medications for it. You have diet. What are the diet? Take a lot of green leafy vegetables, beetroot, and Middle East we have dates. Improve your hemoglobin level to 11. And second thing, start folic acid. So you must be asking, why folic acid? What is the use of the folic acid? Let me tell you, folic acid helps in your brain development of the nerves. So you need to start it well before your pregnancy, 4 weeks before your pregnancy, up to 12 weeks of your pregnancy. So that is the importance of folic acid. Third thing, if you have any medical conditions like diabetes, hypertension, or epilepsy, see that you go and meet your specialist and see that it is well under control before you start. Otherwise, the situation can get aggravated in pregnancy. It can affect the baby. So that is another thing. And the fourth, which I would like to inform all my pregnant patients there, you should have a normal weight, you're overweight, try to reduce your weight and see that your BMI is in the normal range. Now you must be wondering, what is this BMI? We take the weight of the patient, we take the height of the patient, and then we calculate the BMI. The normal BMI is about 18 to 25. This is the ideal BMI. Now you must be wondering, okay, fine, what if my weight is high? What it can cause? I would like to tell you that it has a serious impact on your health as well as the health. When it is related to your health, you tend to have blood pressure in pregnancy, you tend to have diabetes, high risk of going in for a cesarean section, high risk of having bleeding during pregnancy, and with regard to baby, there is a chance of miscarrying pregnancy. And also some abnormalities have also been detected in women who are obese. And baby also tend to grow weight. And that causes again difficulty in delivery, and baby also tend to have childhood obesity.
So overweight is affecting both the pregnant women
as well as the baby. That is why I would advise you should be in the ideal BMI. Yeah. And yes, underweight, I would also like to tell you, you're underweight. If your BMI is less than 18, that is also not good, because that will affect the growth and development of the baby. Fluid level get reduced, you may require to deliver accordingly. So this is a risk. So all this should be optimized before you carry on.
So doctor, if we link this with the other question, like the one of the most frequent asked one also, like what the meal they have to include in their diet.
Yes. Now coming to the nutrition, yes, this is very important topic which I would like to discuss with my patients. Normally in my consultation, I don't get time to discuss with them what are the do's and what are the don't do's of pregnancy. We just come, see how is your baby, how is the mother, we see that they are in good condition and find out if there's any complications. But yes, I feel guilty that, I'm not able to guide them as what things they need to take, what things they need to avoid in pregnancy. So that's why I thought when I'm online with my lovely patients out there, this topic would be an apt. So coming to the nutrition, it is a very important topic because you are going from a transition phase of being a woman or a lady. Right? There is a transition phase from being a lady. So that transition phase, are you aware? In throughout your 9 months of your pregnancy, you have gained a weight of about 12 to 18 kgs. 12 to 18 kgs. So you can have a chart. I think I've made a chart of weight gain in pregnancy. 12 to 18 kgs of weight gain. And that weight gets distributed in the breast tissue, in the uterus, in the placenta, in the fetus, in the baby. So this weight gain gets transferred. Now from where do you get all this energy for this to get distributed, this energy level to your baby, to the placenta, to the uterus? That is through your food. So your food, what you eat, will play a very, very important role for the growth of your health as well as the health. So let me just highlight you on the nutrition that you need to take. I have made another slide on the slide called food pyramid. Food pyramid, it is a chart that tells you what food to take from your day-to-day, the amount of serving of each food that you need to take once you get pregnant. You can yourself prepare a chart of it and stick onto your fridge board, and stick, this is my daily routine. Make it a habit, and I feel happy if my patients really follow this advice. That will be
a specific food they have to eat.
Yeah. So that I would like to tell you. So coming to the main part of your diet. Main part of your diet is the carbs, the grains that you take. You should have 5 to 6 servings. You must be asking, what is this servings? So let me just tell you. 6 servings of carbohydrates. Means 1 serving of carbohydrate can be a slice of bread. That is 1 serving. Cup of oat is a serving. Cereals, pasta, these are all carb. At least 6 servings of carbohydrates you need to take every day. So this is it. I have put up a chart. I can share it with you all after the session. So carry it on. So 6 servings of carbohydrates. Now coming to fruits and vegetables. I tell every patient of mine, take plenty of fruits and vegetables. But yes, 5 servings of fruits and vegetables. So you must be wondering, what is this 5 servings of fruits and vegetables? at least 2 different fruits per day. So 2 different fruits you need to take per day. So fruit wise, like it can be 1 apple, that is 1 fruit, or 6 grapes or orange, any of this fruit, colored fruit, at least 2 fruits per day, and 4 set of vegetables, any vegetables like broccoli or beans or anything, at least 6 set of vegetables in a day. So six servings of carbohydrates, about 5 servings of fruits and vegetables, right? Very clear?
Yes.
Yeah. Now coming to the milk and milk products. Milk and milk products also very much necessary for your health as well as the health of the baby, for the bones of the baby. It is very much required. So fruits, about a cup of milk, 225 ml of milk, that is required. A cup of curd, about 125 ml. Small matchbox size cheese. These are the fruits, the milk and the milk products. So I have discussed with you the carbs. I've discussed with you the proteins. I have discussed with you the vegetables. I've discussed with you milk and milk products. Now coming to the proteins. Proteins, doctor, I take lot. I've seen my patients. I take food every day. How much of fish? How much of meat should I take? At least 2 servings of proteins per day. 2 servings of proteins per day. It can be 2 egg, a meat, fish, or beans. This is rich in proteins, or any legumes. At least 2 servings you should take. Now, yes, another important question. Pregnant women would like to know what type of fish that I am supposed to take, what type of fish I'm not supposed to take. Fish, yes, salmon is good. Sardines are good for pregnant ladies. Salmon, sardine, they're really good. And the tinned tunas, it's good. And the fish that you need to avoid. Why you need to avoid? Because the mercury content in the fish is high. So that again, high mercury content affects the brain development in the baby. So fish like shark, mackerels, these fish, cod liver oils and all those fish, better to avoid it. That's always better to be avoided. So this is the protein diet. Now, yes, you must be wondering now, like, okay, doctor has said so many things to take. So make up a chart today. Today, sit with go to your kitchen, all of you, make a chart on the diet that you need to take. 6 servings of carbohydrates, proteins, fruits, vegetables. Stick it in whatever way you cook, your tradition, according to your tradition. Make it and follow that. And very important, you must be wondering to know, what am I supposed to avoid? Avoid fat. High fat diet. The fried items, I know during Ramadan you tend to fry your food and have, so avoid the fried items. High fat content, the McDonald's, KFC, avoid. And high sugar content, your drinks, the cola, caffeine content is high in that. Try to avoid those. Once a while is fine. Chill on a day like a Friday, chill, you can enjoy that day. Keep 1 day for it, but the rest 6 days work out on this diet, and that will help in the growth of yours as well as the development of the baby.
You will insist that it will be like the diet must be containing the fat and the protein, vegetables and fruit, as well the milk products.
Milk products, yeah.
Doctor, what the must food, like what's the food, which type of food the patient or the pregnant woman she have avoided?
That's also another important question. Yes, the type of food that you need to avoid is, yes, you must be thinking, pregnant lady, I've seen few of my nursing staff telling, take a lot of liver and liver products. Let me tell you, excess of liver and liver products, the animal liver and liver products, is not advised. That again has found out that it can affect the brain and development of the baby. So don't take excess. A small quantity is fine, but not excess, because the vitamin A level increases when you take it in excess. Avoid that. Avoid not pasteurized milk, unpasteurized milk, avoid. You must be having a farm and which milk is there. Pasteurize it and take it. That is the necessary thing. When you handle animals, try to wear gloves, or after you start, wash your hands thoroughly, because so many type of infection you tend to get. Egg, don't use the half-boiled egg. Properly cook the egg. That is very much important. So these are the things that you need to take care of. And I also like to bring up to your notice that if you don't milk
is necessary, curd is necessary, and also vitamin D is necessary in your diet. You need to get exposed a little to the sunlight, not right now. Right now you have a scorching rays and you will have a sunburn because of it. So at least the early morning, about 6:30, little bit of sunlight, because that helps to synthesize vitamin D. Vitamin D gets synthesized in the skin when it gets exposure. It gets synthesized. And vitamin D, you must be asking, why doctor should I require vitamin D? It is necessary for your body bone. It helps in the absorption of calcium. It helps in absorption of the calcium. It helps to prevent a condition in the baby called as rickets. It's a bony condition, the bones of the baby gets weak. Yeah, so that's why you require vitamin D. Either you can get it in the tablet form from the doctor when you check in the initial pre-pregnancy phase, when you check your vitamin D and you find it less, you have tablet form of vitamin D. You can take that. Or you have seen the milk in the Lulu. You just check out. Once you go there, you can just pick up a bottle and see, fortified with vitamin D. That is rich in vitamin D. The butter that you take, that is also rich in vitamin D. So that helps to give you enough vitamin D. And some oily fishes, like as I said, salmon and sardine, they are also rich in vitamin D.
So, doctor, the pregnant woman who's having a healthy diet plan, does she need to also to intake supplements?
Yeah, supplementation is, if you are on a proper diet, as I said you, Yasmin, like if your hemoglobin is 11 grams, I will not advise my patients to take iron tablet, because I know it's really a terrific thing to take the iron tablets. And the patients, I know you all that it's really, you feel stomach pain, you feel gastritis, you have a change in the color of your stool. So if your hemoglobin is 11, yes, thumbs up to you all. It's good, excellent. Take a diet rich in green leafy vegetables and dates and beetroot. Put some lemon, that will help in absorption. So you don't require, but if your hemoglobin is less than 11, you need to yourself take a supplement, because that's it. You can't take a chance with your life or the life of the baby, because once you are 3 months, 4 months, your blood level will increase. It is this blood level that grows to the baby. First 3 months is fine, but later after 3 months, the baby takes the hemoglobin, the nutrition from the mother. So if your hemoglobin is less, you tend to have fall in your hemoglobin level. You'll feel weakness, fatigue, you feel very tired, no interest. And even when during your pregnancy, you tend to bleed much. Allah's creation is such a way that the baby takes all the nutrition from you. It is the mother who starves. So why take a chance? If your hemoglobin is less than 11 or in the last month less than 10.5, take it off. Take the iron tablets, close your eyes and just take it. If you take it with orange juice and lemon juice, that increases the absorption of iron tablets. Then calcium tablets also. If you feel muscle pain, nerve pain, switch on to it. Those calcium tablets are usually better. I'll tell you, it doesn't cause much effect on your health. So these are the extra supplements, like omega-3 is also there. If you can take fish, that is really good. Then you need not take extras. If you're a vegetarian, better. If your vitamin D level is less or this, you can take extra supplements. It's there in the pharmacy.
Thank you so much, doctor, for this information and for joining us.
Thank you, Yasmin. Thank you. It was really a wonderful thing for me to come on live with you all and share my knowledge, because I've never done this. And this topic is something that I don't really discuss with my patients. So once I got an opportunity to come down, I thought this would be a right apt, and I need to inform all my patients out there. Today itself, sit down, make a diet chart. Make a diet chart of yourself. This is what I am to take according to the servings. Stick on, follow it, and I assure you, your health and the baby's health will be in the top position.
Just in addition of your thought, doctor, that we can also add that we are having appointment system. They can contact us either through the social media or through our WhatsApp number 960-96060. Just before we ending this live session, we would like to see the comment box in case if there is any Telegram messages, so we can reply to that.
Sure. I would love to, clarify your doubts if anything is there that needs more clarification. If I was not very clear enough, you can always send a message and I'll get back to you.
Most appreciated.
Thank you so much.
So just